Hi, this is Dr. Raj here, board certified plastic surgeon based in Dallas, Texas. Today I'm going to uncover the truths and dispel some of the myths concerning liposuction. So one thing that people believe is that if you have liposuction, fat moves elsewhere. Truthfully, fat doesn't really move anywhere. We have a certain number of fat cells, and it pretty much stays that way forever. The fat cells can get larger if we gain weight, they can get smaller if we lose weight. When we have liposuction in one area, those fat cells are permanently removed. Let's say somebody were to get liposuction, they're more contoured, they're happy with how they look, but then they put on a lot of weight. The other areas that did not get liposuction may seem bigger just because that the fat cells have gotten larger and they never had liposuction there, but that doesn't mean that fat migrated or moved to that zone. The next thing, I won't really say it's a complete myth. Liposuction, can it improve health? Well, it doesn't have a direct health benefit. Like, for example, it's not going to fix a lab abnormality. If you're doing it for cosmetic reasons, it may not fix a particular condition, medical condition. But one thing I do believe is the psychological benefits are, of course, there. So having liposuction or an elective plastic surgery procedure can improve one's confidence and just in general how they feel about themselves. So some people may purport that liposuction is painless, or it's just something that you can go in and do and then be on your merry way. Some areas of the body where a small amount of liposuction is done, yes, relatively painless. Most people are kind of back to work or back to what they do fairly quickly. But liposuction really is a very broad procedure in a way. It can be done pretty much anywhere in the body. There are different amounts that can be taken out. So really how the recovery will be depends on the patient and depends on what exactly is done. So I believe, like, my patients or anybody I talk to should not assume that liposuction is completely painless and easy and, a walk in the park. There are certain types of liposuction that will have some recovery. There will be some healing. Patients may require pain medications and other forms of treatment to help them through the recovery process. This is a big one. A lot of people think that liposuction is an answer for weight loss or for obesity, and truthfully it's not. Liposuction is an aesthetic procedure meant to contour the body. So it's better to remove stubborn areas of fat or to try to change the shape or the appearance of certain areas. I do not feel it's a good modality or a method to lose weight, right? Doing liposuction for weight loss, to me, people that attempt to do it, what happens is they take out large volumes of fat, but then the patients end up having loose, sagging skin. It doesn't really improve their contour. They may only lose a few pounds. I just feel from an aesthetic standpoint that doesn't look good, and also it's not really a long-term solution for weight loss. There are much better things that one can do for weight loss, and I'll just list a few. For example, of course, we have our traditional methods, right? Proper nutrition, exercise. We have other methods. There are now a lot of weight loss medications and supplements on the market. And for people that need to lose larger amounts of weight, bariatric surgery is an option. So this concept that liposuction provides permanent results. If you get liposuction, yes, the results should be long-lasting. But we have to remember that as time goes on, especially with aging, or with any type of weight gain or lifestyle changes, things can change. So if we were to lose a significant amount of weight, gain a lot of weight, or for example, women that become pregnant, or just with time with aging, with skin that loses its elasticity, all of these changes that can happen just due to time and the environment can affect the liposuction results. So my recommendation for patients, and the patients that have the best outcomes, are the ones that have a good diet exercise regimen, have a very good lifestyle, they're getting liposuction to contour certain areas, and they maintain the same lifestyle so that they maintain the same results. It should last a long time, and what I mean by that is years. But is it going to be permanent, like last them for 20, 30 years? It's unlikely.